I welcome now Professor Tom Calma AO, who's got an extraordinary job to tackle smoking. Welcome, Tom. Can you introduce yourself and tell us about your job?
Tom Calma. I come from Darwin. I've got Kungarakan is on my mother's side and Iwaj on my father's side, but I live in Canberra now in Ngunnawal country, and I pay respects to elders all across the nation, and particularly our youth, who are going to be our future leaders and the custodians of our stories, our cultures, our histories and our languages. My role, I guess I have two roles. One is as the National Coordinator for Tackling Indigenous Smoking, and that's a program run by the Commonwealth Government. But I'm also on the Indigenous Cancers Leadership Group with Cancer Australia, where we look at all cancers. But particularly, my interest is around smoking and helping our mob to give up smoking or to not take it up in the first place, which is the best strategy.
Why is giving up smoking, reducing smoking, critical to closing the gap? Why is it so critical?
Look, the thing about smoking is that it has such a massive impact on our health. In the past, we thought it probably contributed to about 20% of the burden of death for Aboriginal and Torres Strait Islander people. But the more recent studies that were done by ANU and led by Dr. Katie Thurber looked at the 45 years and older study and cohort, a 10-year longitudinal study. And what it found, which was very revealing and actually a bit depressing, and that is that people over nearly 50% of all deaths for people over 45 years of age can be attributed to a smoking-related disease. And for those who are under 45, it's around about 37%. So we can just see how massive the issue is about smoking and the impact it has across our health. We often think it's just lung cancer, but in fact it contributes to most cancers, and but also cardiovascular and other respiratory issues. And it's not only people who are active smokers, but it's people who are exposed through secondhand smoke. And then if we look at mothers who are either smokers or are exposed to smoke during pregnancy, that also has a fairly significant impact on the fetus and the newborn baby in both respiratory issues, asthmas and so forth, but also, it's what we call epigenetics, and it's a fingerprinting. So it's already, babies are born with a predisposition towards an addiction. So that's why we're very keen on targeting your mothers who are smoke or in the presence of smokers, and trying to target the family unit, because everybody's got to recognise that we all have a role in this and changing it. But also a lot of attention is paid to our youth who don't smoke to make sure that they don't take it up. And if we can do that, we will make a big difference. But, unfortunately, when it comes to cardiovascular diseases, heart diseases, strokes and so forth, when somebody gives up smoking, there's a fairly quick response and your cardiovascular health improves relatively quickly, as does your respiratory. But it's when it comes to cancers, there could be up to 20-year time lag from when you give up smoking or exposed to smoke and when you potentially can get a cancer.
What have you achieved so far that you think, well, at least we're starting to make progress?
What I run, the Tackling Indigenous Smoking program, has multiple faces to it. But one of them is a population health approach that's done through 40 teams located across Australia. And they're teams of 2, 3, 4 people, and they run a population health approach. So they're out there working with the community in with groups to get them to understand about the impacts of smoking, both the detrimental impacts if you're a smoker, but the positive impacts when you give up. But also we look at the economic impacts. So that's one level. We also provide funding towards a program called Quit Skills, which is about working with people in the community and teaching them how to do a brief intervention, as well as the Quit Line, enhancement, which is about placement of Aboriginal and Torres Strait Islander quitline officers around the nation. So it's a multiple approach. Primary health care through the Aboriginal community controlled health clinics plays a very big role, and the role of health workers and doctors and nurses and allied health professionals who do these brief interventions. And the first thing is to ask somebody if they smoke, and if they do smoke, have they thought about giving up? Do they understand about it? And if a health professional, particularly a doctor, asks that question, we see a higher incidence of people attempting to give up. But state and territory governments, the cancer councils, and so forth, all run programs. So it is a fairly significant approach, but it is such a significant impactor on health that it is very important that we don't take our foot off the pedal, and we see the outcomes that we're starting to see now. Smoking has become a cultural activity for Aboriginal and Torres Strait Islander people. It was something that we learnt and that it was actually condoned by government when they provided cigarettes and tobacco in lieu of wages. And so that didn't end until the mid to late 60s when we got equal wages and people had to pay wages. And so we've got to try and overturn that cultural practice that we have for many people smoking. But we do know that we've seen some great results. 10, 15 years ago, over 50% of our population smoked. It's now down to about 37%. But in rural and remote areas, very remote areas, the incidence is much higher. So, it's got to be a joint approach, and it's something that we can do. And just in that last 15 or so years, we've seen that an estimated 50,000 people have given up smoking or not taken it up. Aboriginal and Torres Strait Islander people, absolutely fantastic. And that's estimated to have saved about 23,000 lives. Mm-hmm. And that's going by the data. It's the single biggest health intervention that's had the most success. And that's Aboriginal and Torres Strait Islander people quitting or not taking up smoking.
Tom Calma, wonderful to hear about your work, and I know everyone watching this is going to do what they can to support your work tackling smoking. Thanks for talking to us.
Thank you, Julie. And remember that we've just seen World No Tobacco Day, and the theme this year was Commit to Quit.
Thank you, Tom. Thank you.
Thank you.